Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hi friends, I am Dr. Jayesh, Ranawat, ENT surgeon practicing in Mumbai. I'll be talking on the topic understanding vertigo, why it happens and what it means. Have you ever turned in bed, looked up suddenly or stood up and felt like the whole room was spinning? If yes, you are not alone. That spinning feel is often called vertigo, and for many people it can really feel confusing, frightening and deeply unsettling. Welcome to Steady Balance. This is episode 1. Today, let us understand vertigo in simple words. What it is, why it happens, and what your body may be trying to tell you. First, one important point, vertigo is not a disease by itself. It is a symptom. In simple terms, it is a false feeling that you or the whole world around you is moving even when everything is actually still or steady. Some people describe it as spinning. Others describe it as swaying, tilting, or feeling pulled to one side. It may also come with nausea, sweating, unsteadiness, or sudden fear because your sense of balance no longer feels normal. So how does the body normally keep us balanced? Your balance depends on 3 systems working together. Your inner ear sense movement and position. Your eyes tell your brain what is happening around you, and your muscles and joints tell your brain where your body is in space. Your brain blends all of these signals together every second so you can stand, walk, turn and move safely. When the signals match, you feel steady. When they do not match, the brain gets confused, and that confusion can lead to vertigo. In many people, the problem starts in the inner ear. Inside the inner ear are tiny balance organs filled with fluid and delicate sensory cells. The semicircular canals help in detecting turning movements of the head. The utricle and the saccule help detect the straight line movement and gravity. When this system sends the wrong message, or when the message does not match what your eyes and body are sensing, the brain may wrongly think that the movement is happening. The false message creates the spinning feel of vertigo. This mismatch can also cause nausea, vomiting, unsteadiness, and abnormal eye movements. So if vertigo has ever made you feel frightened or helpless, please remember, it is a real physical symptom. It is not imagined, and it should not be dismissed. One of the most common causes of vertigo is BPPV, or short for benign paroxysmal positional vertigo. The name sounds complicated, but the idea is simple. Tiny crystals in the inner ear can move out of place. When that happens, rolling over in bed, bending down or looking up can trigger sudden spinning. The good news is that this type of vertigo is common and often treatable. Another cause is vestibular neuritis. This happens when the balance nerve becomes inflamed, often after a viral illness. The result can be sudden severe vertigo, nausea, vomiting and trouble walking steadily. The third cause is Meniere's disease. In this condition, changes in fluid balance inside the inner ear can interfere with normal hearing and balance signals. Along with vertigo, a person may also notice ringing in the ear, hearing loss, or a feeling of fullness or pressure in one ear. It is also important to know that not all vertigo comes from the ear. Sometimes it can come from the brain, for example, migraine, multiple sclerosis, or in some cases, stroke. That is why vertigo should not be ignored. If it comes with a warning signs like double vision, slurred speech, facial weakness, numbness, trouble walking, or a sudden severe headache, in those situations, urgent medical attention is very important. The good news is that many causes of vertigo can be treated. Some people may improve with simple head positioning maneuvers, especially in BPV. Others may need medicines, balanced exercises, or treatment for the underlying cause. So the key message to remember in this, vertigo happens when the body balance signals become mixed up and the brain senses movement that is not really there. If you or someone you know is having repeated spinning episodes, falls, hearing changes, or severe symptoms, please do not ignore it. With the right evaluation, the cause can often be understood and treatment can help bring confidence and balance back. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.